Good morning. I think that we're live, and I am here with Dr. Paul Lorenc, a board-certified cosmetic plastic surgeon. Very excited to be here in New York City with you.
Good morning.
A little bit warm outside, but it's beautiful, and I came to give you a rose for my daughter's wedding, which was this weekend, and that's what brought me to New York City, and it was wonderful.
Thank you so much. I'll have to put it in my lapel maybe for the day.
Okay, that sounds exciting. And it's very interesting because today our topic, we're talking about selfies, and we're talking about the facelift selfie and how people are describing themselves when they're looking in the mirror and when they're looking into a camera or a video. And it was really interesting this weekend to observe hundreds of people at the wedding and at all the events we had all weekend long, taking photos saying, no, I don't like that side, or I don't like the way my eye looks, or don't take my double chin, don't take it from, and I can see how the studies have shown the increase in this industry for plastic surgery, even starting in 30 years old now. And I'm wondering if you are finding many younger people, because of this selfie and the social media and what's going on out there, to be something that's bringing people in and more aware of the way that they look.
Well, of course, it's being driven by social media, and of course, we're seeing a total expansion of my patient base, so to speak, and it's patients in their 30s and even late 20s. So there are a number of factors. Social media is so important. I have two teenage children. I don't have to tell you more than that.
They probably sleep with the telephone by their ear.
All day long. Everything is documented. But what happens is, not only is it documented, but it's shared. You and I are just talking, let's say, outside of the camera, but on social media, it's multiplied. It's an order of magnitude different, so it's very important to look good. And it's about the eyes and how you look when you take your selfie. When you're on social media, it becomes a driving force. We have seen an incredible increase, actually, recently, not only of the 30s and late 20s, but really even 40s and 50s, because that generation is also incorporated.
Listen, I fit into that category. My daughter says, Ma, you don't really know how to take great selfies. You have to look up into the camera. And the same thing when you're talking live to somebody on a chat. The same thing, or the same thing on videos. When we see ourselves on videos, we're all self-conscious. Oh, do I look good? Do I have enough makeup on? But the social media influences our lives so much, and our self-esteem is so important. So I can see your job, even now as a board-certified plastic surgeon in New York City on Park Avenue, in a great location, in a great office, being a magnitude for people to just want to walk in and say, what can you do for me? How can you help me? I love the Selfie Facelift. Tell us what the Selfie Facelift is. And by the way, I want to tell the audience about a little work. This is a book that Dr. Lorenc had written, I think it's about 10 years now.
Yes, it's 10 years exactly.
And so now, at the end, if you stay tuned, I'm going to ask him when his next book is coming out and what that book is going to be about. I think it's time, and maybe we can even help you do that as consultants. And by the way, we want all the questions, any comments now or after when you're watching this, they will all be answered, and we totally appreciate your communication with us through Facebook Live. So make sure to tune in. Every Wednesday at 1, I have a show, but this was a special edition, and I'm proud to say that Dr. Lorenc is going to be on the Today Show, but you have to stay tuned, and I'll give you the date. He'll give you the date, but it could be coming up very, very shortly. So tell us a little bit about the Selfie Facelift, which I think is great and amazing, and it's so today.
Well, it encompasses, it's what we call age-appropriate facelift, and it can be a standard surgical facelift. It could be just fillers. We call it facelift by syringe. It could be even something as I'm going to show you right now, which I think is the coolest, latest
Wow, what is this? This is very interesting.
It's a specific suture that's completely absorbable, and it has little cones on it. And the cool thing about this is that it's placed in the midface, and then it elevates the face. And it
so you mean you just put it in my face?
Absolutely, and then I advance the tissue.
So where would you put it on me?
Well, not that you need it.
I do.
But all it does is just by placing it right here, just relax your face for a second. What it does, it elevates the midface, highlights the cheek without really any surgery. This is just done under local anesthesia, and very little downtime, maybe 24 hours. But the point is that new technology is also driving the selfie lift because it's less downtime. It's a lot of times there's no need for anesthesia, less recovery, and patients love it. But it all goes back to, again, being fed by this desire to look good on social media, in photographs, when they take a selfie. Actually, my office manager, Lorenc, coined that frame, selfie lift.
I love it. You need to go online today and do
Absolutely.
it.
Absolutely. And it's a marriage of new technology, less invasive procedures, and the social media that are sort of combining to explode really a practice such as mine, because we do offer incredible breadth of different devices and different procedures from the surgical to the completely non-surgical.
And what are you finding? You're finding more non-surgery now because people don't have the time, the downtime, and they want non-surgical. We want to go in. It's like one and done. We want to look great. We want to look terrific, and we don't want any downtime.
Well, that's exactly right. For instance, one and done. My favorite saying is when I use ThermiTight for tightening the lower face and the neck. It's using radio frequency. It's a new form of energy that we are using without the need for a surgical approach. Now, don't get me wrong. Facelifts are here to stay, and in certain patients, in certain patient population, that is the answer. But in sort of a younger population, or even a post-surgical enhancement, I use radio frequency to tighten the skin and tighten the neck. It's a wonderful procedure with very little downtime, so that's why it's becoming very popular. And really, if you look at the ratio of non-surgical to surgical procedures in the country, it's really on the order of 9-to-1 right now, and of course expanding.
Right, and that helps you too because if your patients are coming in that are 30 and 40 and 50, but they're not quite ready for that facelift yet, you have all these alternatives of combination therapies to offer them, which is great. So do you do your sutures along with the Thermi RF? Do you do it along with a facelift? How do you combine your combination of therapies, maybe in ages like for, the 30s through the 60s?
So it's first of all, it's about maintenance. So it's about maintenance starting from from a little child and sunscreen. And it really is about maintenance throughout your life. And then it's a combination, and it's very specific, and it's designed for each patient on a very specific basis. So yes, it's a combination of silhouette Instalift, which is the suture that I place in the midface, and it might delay a surgical facelift. It enhances the midface, eliminates the nasolabial folds, and even the jowls.
You know what, let me stop you there. How long do these sutures, how long do they last? People wonder, so you're putting it under their skin, it's non-invasive, they go home, they can go out that night or the next day.
Next day.
When will they see a difference, and how long is it going to last?
Well, they see a difference right away because what Silhouette Instalift provides is an instant lift, as the name implies, and then as it gets absorbed, because it's a completely absorbable product from polylactic acid, you build volume, your body creates collagen. And that's the cool thing about it, is that first you get the lift, and then you get the volumization. And we see the effect lasting for close to 2 years.
Well, that's great, because I know that they're doing it in Europe for a long time, and it's very new here, and I know you're one of the founding fathers of it here in the United States, because I was at a recent show in Las Vegas where you were training all of the doctors from all over the world. You had a room of, I think, 300 or more. I was very impressed, and I thought that was great education. And people wonder, how could, now, they mention sculpture, that there's something in the sutures that actually becomes, and so maybe you want to explain that, because I'm not sure that our audience really does understand that.
So this particular product called Silhouette Instalift is a suture made out of PLLA, polylactic acid, and the cones are also made out of PLLA and PLGA, polylactic acid, which is exactly the same product or compound that sculpture is made out of.
That's very interesting.
And what happens is your body, as your body is absorbing this product, both the cones and the suture, it stimulates collagen. It's what we call a biostimulatory product. That's what I find fascinating about this particular product. But again, it's not only giving you the volume as it gets absorbed, but it gives you the insta-lift when I place it. So this is, and the beauty of this is that, of course, it's done under local anesthesia. It's done in the office. You go home the same day. I usually tell patients to take a day just to chill out. Not that they have to be bedridden, but they just take it easy for a day and then they can start full activity.
That's great. Do you actually do sculpture and other combination therapies, as you talked about the facelift with injections and injectables, and do you use the sculpture, and how does that compare?
Sculpture is a wonderful product. It's a product made by Galderma. It's a injectable, as you know, and it volumizes the face. I use it in younger patients just to volumize the face, a lot of times in the temple. If you look at patients and people as they age, we get hollow in the temple as your body loses subcutaneous tissue. Sculpture is a perfect product for that. But I also use it post-surgically. I use it in patients where I have done a facelift, I've done a surgical correction, but as you know, surgery does not create volume, it repositions sort of tissue. And then after several months, what I will do is to add volume post-surgically, I will use sculpture. A lot of the times, it's a combination therapy. I think that's the best term to describe what I'm doing right now as an aesthetic plastic surgeon. It's just not one device, it's not one form of surgery, it's really a combination therapy. And that gives you the most natural and really the best result that we can obtain in patients really throughout the aging process.
And I think you hit on a key word, natural, because everybody wants to look natural. Nobody wants to look like, oh my God, I had a facelift, or oh my God, I had too much Botox. I mean, that's what people are scared about. And recently talking to 30-year-olds, my daughter's friends, at her wedding, or, they're like, oh, we'd love to get Botox, but we don't want to look fake. Or we're ready for something, but we don't know what it is. So how do you sell this procedure to the 30-something-year-old when they call or come in and do a consult? And how would you tell other doctors, what are your tips or your keys, points that you would suggest, either the front desk or the person doing the consult? And by the way, is that you, or is it your office manager doing the consult, Lorenc, or who? I know you have several terrific people here.
Well, if you think about it, we all do the consult. It really starts from the time that the email comes in, the text comes in, or the phone call comes in.
And who answers that?
My front person. Okay. But it's really a combination, because we also have my office manager who answers the live chat and who speaks to the prospective patients. The phone is picked up again. We get incoming from all over, whether it's text, email.
You're happy that they're calling.
I am ecstatic that they're calling. There's nothing better than patients calling.
Right.
But I think that's the most important step, because I could be the world's greatest aesthetic plastic surgeon, but if the prospective patient doesn't get to that first step in a happy way and in a successful way, they'll never see me. So I think the people who are answering those calls and emails and texts are very important, that they know what they're talking about, they're well educated, and they represent me well. And I am the luckiest person on earth.
That's so sweet of you.
I do. I have a tremendous staff, support staff, that without whom I could not be this successful.
But it starts at the top, and it starts with somebody like you that feels that way.
Well,
and
I think it's a two-way street.
Right.
Yes. But what happens is that really it's a process, and we take the patient or prospective patient through the process. What I always recommend to prospective patients is that do your homework. I think that's the most important thing that you can do to keep yourself safe. So ask about the qualifications of the physician that you're seeing.
Very important.
Board certification. What kind of board certification is it? What kind of training he or she has in that particular procedure? For instance, take silhouette insta-lift. It's very technique dependent. It's important that your physician is trained in that, because it's again a very technique dependent procedure. Just like when I am trained in doing a facelift for many years, it's important to ask those questions. Okay. So do your homework before you sign up for surgery.
That's very true. All of us are on the internet doing our homework. Absolutely. On Real Self or on the internet. We're looking at your testimonials. We want to see happy patients. We want to see before and after pictures. So when you go on the Today Show, what is going to be the topic that you're going to talk about, so we can all look forward to that?
Well, I think it's what you sort of implied already, the sort of the change in the really the expanse of what we're doing, or the expenditure of what we're doing as far as the different age groups coming in and having procedures. The other thing that I want to mention is that technology is driving what we do to a large extent.
That's very true.
I've been in practice for 20 years. And technology has really become a very, very important part of what I do, and what I can do as far as being an aesthetic plastic
So
surgeon.
when you talk about technology, you're talking about like the Thermi injectable RF, and you're talking about new pieces of equipment. When we think about technology, an average person, they might be thinking about the cell phone that we're on doing this Facebook Live with beautiful Forever University this morning. You know.
Well, yes, I'm thinking and talking more about different fillers, for instance.
Okay.
There's an explosion of different fillers that we have with different physiochemical properties that I can adjust and I can choose to get a better result, more natural result. I'm talking about energy-based devices, radio frequencies such as Thermi, Thermi Smooth, ThermiTight. I'm talking about lasers and really different permutations of lasers. I'm already on my 3rd generation laser lipo laser.
Wow.
So this is very different, and I almost think that the first laser that I had was like a little baby compared to a giant laser that I have that's a very powerful tool. Now, to me, it's a tool. It doesn't assure a great result. It's just a tool that I can use the right way to assure a great result. So it's exciting to be in aesthetic plastic surgery at a time that we have these new devices, and even Silhouette InstaLift. It really is the first of its kind in this particular space because it allows us to lift tissue and suspend tissue without the use of surgery. And how cool is that?
No, I think it's great. And what do people expect to pay for something like that? You know, because in the marketplace, people think it's not affordable. And I do have to give you credit because I do see that you have patient financing options. And I am a believer in that. Because it's not always that somebody could take money and just give you a credit card, give you a check. So making it affordable to people with options of how to pay is great. But what is the range of fee approximately if I would come in and say, okay, I want the InstaLift?
Well, the InstaLift, it really depends on the number of sutures because we buy it per suture.
Right.
But typically, now I want to preface that by saying that it's very region dependent and practice dependent.
That's true.
There's a very broad spectrum.
Well, let's say here in New York. I mean, I'd expect you, with your certifications, with you being a trainer for, you know, the company and being one of the lead people from Europe, you know, in the U.S. with it, that I would pay more coming to you, but you have the credentials, so it's worth it to me to know that.
So even in New York, there's a spectrum, and the spectrum in New York City right now is about $3,500 to $5,500. That's sort of the spectrum. But nationwide, it's a little bit broader. But it all depends, and I think you're absolutely correct, and I agree with you. Then you also, it's that the old saying, you get what you pay for. And I think whether it's a surgical approach or non-surgical approach, obviously someone who has a lot of experience, someone who teaches it, someone who writes on the subject, obviously can charge more. But you know, in my mind, it's not about the price. It's really about the result. It's about the predictability of the result. It's about the safety of the result. And it's about the natural result of the result.
Absolutely. And I've seen some of the before and after results, and I was amazed, saying, this looks great, looking in the mirror, saying, what do I need? Do I need it done? And, well, a little work we all can use. And this is Dr. Lorenc's book. Where can they find the book? Is it on Amazon? Do they have to call your office?
They can call my office, but it's certainly on Amazon.
It is on Amazon. So on Amazon, you can look for A Little Work, and we can learn more about the truth behind plastic surgery. And I think that that's great. So tell us a little bit more about your future idea, about a future book that we'll have to talk about. Maybe we can co-write something together.
Yeah. I've been fascinated throughout the 20 years of practice by the psychological aspect of aesthetic surgery. And that's the topic that I want to explore, because it's really the psychology of what I do is fascinating. If you think about it, it's I consider it a privilege, because when I walk into the room, and obviously I consult with a patient, usually twice before surgery, before they decide on the surgery, it still amazes me, the trust that a patient puts in my hands.
Right, we only have one face, and we want to look great, and it's not like getting a manicure where we can change the color in 5 minutes.
And it always amazes me how, and that's important. That's tremendously important in the psychology of how the decision is made and so forth. And that's the topic that I like to explore in my next book.
And I often talk about the psychographics of what has somebody make the purchase, especially a woman who makes most of the decisions, and how they make decisions, and the time of the month and the time of the year. It's all very, very interesting. So when you do a consult, how long do you spend on a consult?
Initial consult about half an hour.
And do they pay for, the consult? Is there a fee that they have to pay?
Yes, we charge.
Okay. Now, does that go towards their procedure when they come in?
It does.
Now, you said that they might come in for a second consult.
Yes.
How long would that be? The same?
Well, it depends. Usually, and if I am doing a surgical procedure on a patient, I insist that they come in the second time, because people have more questions. They might think about it. They'll speak to their friends, look up on social media. They'll check with Dr. Google about the procedure, and they will have more questions. And I think it's very healthy for patients to come in for a second consultation. It's a little bit shorter than the initial one, but it's more directed. Now it's more focused. We drill down into what we're going to do, the pros and cons, and so forth. But I think, again, it's very healthy. Also, it establishes a better relationship between the patient and the physician, and I think that's an important aspect of what I do.
No, and I think it's important to build that bond and to build
Absolutely.
that relationship, because even though it might be a one and done, you want people coming back. And I'm always talking about the life cycle of the patient, and you want to keep the patient from the 30s to the 60s and 70s and on. And my grandfather's girlfriend was 96. She said, "Your grandfather is so good looking that I need to get a facelift." And I actually took her to go get consults, and they said, "This is crazy." But we're living longer, which is a great thing.
We like that.
That's right. We need to stay healthy, and we want to look good. And people are working, to an age that's like in the 80s. People don't want to retire anymore.
Exactly.
It's like, unless you retire to something,
But what it does also, it's about maintenance. And it's not and even though we use the term one and done specifically for ThermiTight, because we love that procedure, it's just one-time procedure, but those patients stay in the practice. And it's because we have other things that we can offer. And again, it's about maintenance. It's someone who starts off with non-surgical, with fillers, or with radiofrequency devices, and then transitions into a surgical approach, or their family comes in, or their friends come in. It's a wonderful time to be an aesthetic plastic surgeon. It really is, because now we can offer a very broad spectrum, really for all of the ages. And some of my youngest patients are obviously in their 20s, but yes, I have taken care of, and I do take care of patients into their 80s. And it's wonderful to see this very wide spectrum.
No, that's great. And I see you on the internet. I see you on the website. What other marketing would you suggest to other practices, really, that has been the most beneficial? We know you're in New York City. It is a little bit different. Are you marketing on the jitney to the Hamptons? Because I notice there's a Hamptons address that you have. I mean...
Yeah, I have an office in Southampton, but this is just mostly for the convenience of my patients from New York City. They all move out to the Hamptons.
And then you get a weekend away.
That's
not a bad thing.
I know. I get to spend some time with my family out there.
That's great.
I don't advertise on the Hampton jitney.
Okay.
I think probably the most important way to really spread the word is within your practice, using your patient population, your patient basis. When you have something new that you have been taught, or you explored, or you bought a new piece of equipment, so to speak, let your patient population, let your basis know. E-blasts are wonderful. It's a wonderful way to communicate with your patients. Hold evening seminars. I think that's still very, very productive. More on a one-to-one, and usually when we have a seminar, we don't do them often. We do them maybe twice a year, but we usually draw about 50 patients to a seminar like that, usually to introduce a new device or a new technique, and those are very, very productive.
Yeah, as a matter of fact, I think we helped you from Beautiful Forever do a jumpstart program through your ThermiTight, and I know you had great results.
Great
had I saw some of the videos and some of the testimonials, and that was great. Events are terrific, but there's a lot of practices out there just starting in aesthetics. They're not board certified plastic surgeons, but they're dabbling in aesthetics, and maybe they don't have a big database yet. Maybe they're a young practice. What suggestion would you give to a young doctor starting out in a new practice?
It's always a balance. It's always a balance of how much money do you want to spend and what kind of an ROI are you looking for. And I think that's the complex question, and that's the difficult question. But I think, looking at PR firm to represent you, I think that's one way to explore it. Again, you have to look at what you have to spend in order to generate.
And we do marketing. We do marketing programs. We do 12-month marketing calendars. We do budgets. And it is true, but I do believe that a practice should not spend less than 7 to 10% of their projected revenue in marketing, no matter how you spend it. But when you're first starting, you really have to have allocated at least 20%. And it's the number one reason that businesses fail in America is because they don't have enough money for marketing. And it's sad because you go through all the training that you go through,
Absolutely.
and then you say, well, now that I have all this great equipment and all this technology and I'm so well trained, how do I get people to come in? And that's, as consultants, we do help practices all the time with that, because getting people in the phone to ring, you're lucky enough to be very established, have a very good name, have a lot of happy patients. And I agree with you, the word of mouth marketing is the least expensive.
Correct.
And will get you the most. I mean, everybody on Park Avenue could be talking about you, and that's the best thing. You couldn't put an ad in that could pay for that.
But I think as you start out, and I think you hit the nail on the head, you have to think about this also as a business, right? Because remember the old days of just finishing up, hanging up a shingle, they're gone. So you have to think in terms of a business sort of situation, and then evaluate your practice in that way. And yes, allocating the right amount of money for marketing, for pay-per-click, for presence on the web, designing the right website, and on, and all of those things, I think it's important. But it's not only about practices. As you say, a lot of businesses fail because they do not expend enough money initially to start, and many good ideas die because of lack of funding. But I also understand, and it's sort of an interesting and sad in a way, that the residents and the fellows that we train, I know how much more difficult it is for them to go out into practice, because it's much more complex right now. It's much more competitive, certainly, because you have a much wider field of physicians doing what we're doing. So I think it's very complex and very difficult. And one has to think seriously about whether to go into private practice and go through the process, join an academic institution, or join a group practice. And I am glad that I am in practice for 20 years and not just finishing up my fellowship.
And it's interesting because somebody asked me recently, one of our affiliates, to start speaking to fellows and residents, because there's not a whole lot of marketing and business, taught to most of the physicians. My husband being a physician, I know that, even though I'm a little bit older than you, but in those years, nobody talked about marketing or how do you get patients through the door. You're taught to be a good doctor, do the right thing for your patient, and they will come. But now it's a cash pay business. This is a retail healthcare business. It's no longer insurance. You might take insurance for some reconstructive work, and I don't know if you do or not, but basically there are a lot of doctors that will still take insurance and do a combination of therapies.
I think it has become a sort of a two-tier almost system. I don't accept insurance.
Okay.
Not lucky to be able not to do that because for all the things associated with it. But there are some fine practices who are totally insurance-based. So it really depends on what you're doing, and whether you're doing breast reconstruction, for instance, or you're doing aesthetic surgery and aesthetic procedures such as myself. But I think it's an issue that you have to think about before you open up that door and start your practice. It's very complex. You have to sit down. I would highly recommend to reach out to someone like you, get some insight, and get some info and get some feedback on how much do you have to think about spending to opening up an office.
Well, we usually recommend doing a business plan and having pro formas and having numbers, because most physicians, honestly, are not good with finances and numbers. So you need to have a good finance person. The best partnership, and you have one here, is with a physician and somebody who knows marketing, and somebody can help you with budgets, because you need a combination. Not one person can do everything.
No.
And so I think you have a great combination here, and I know you have patients waiting, and I very much appreciated, this time with you today, and glad to be here in New York City with Dr. Paul Lorenc, and Paul Lawrence. I know everybody says your name a little bit
I
different.
know. It's Lorenc, but it's Lawrence, like Lawrence of Arabia. I tell
Okay.
everyone.
And you know what? As long as they keep
But it's
calling.
But it's spelled differently. It's Lorenc.
Yeah.
So that's the difference. Exactly. As long as they keep texting,
That's right.
emailing, and calling,
They could
we're
call you
okay.
whatever they want. Mr. Hampton, whatever, right? That is just, so I thank you so much.
My
It was really
pleasure.
so
My
nice to have
pleasure.
you on the beautiful Forever University, which is also a whole educational program that we're starting, and eventually membership program and more. But tune in live again. As a matter of fact, tomorrow I am actually going to be doing another one, which is my regularly scheduled show at 1 o'clock Eastern Standard Time. And please ask questions. Sorry we didn't get to too many questions today, but we always get to answer them, even if it's not live. And have a great day, and stay tuned to Beautiful Forever Aesthetic Consulting. And if somebody wants to get in touch with you, what is your website?
The website is lorenc.com. That's Lawrence.com. And our phone number right here on Park Avenue is 212-472-2900.
Well, I thank you very much, and it was really great. And I think I might have to come in for some Insti-Lift. Can we do it today instantly? Thank you very much.
My pleasure.
Thank you.